focus on the CTO PCI, but in this time, I would like to switch move to on the fundamental guide wire, and especially Sion one. And I would like to show the case. This is RCA and the RCA region. And from the middle part, we can see the severe stenosis. And very unfortunately, we can see the very tortuosity and the middle part and the projection part too. It looks like very difficult to insert the guide wires. So this is a real view, and still we can see the tortuosity and a very severe tight stenosis, and especially the projection part. These are situations very difficult to get advanced guide wire. But in this time, I choose a Sion guide wire because of this Sion guide wire have the good maneuverability and the good durability. And actually, as you can see, this movie and show this guide wire movement. And even if the excess this very big bend, but still this Sion guide wire can keep the control. And after that, and especially this part looks like a corkscrew part, and usually they're very difficult to the passage. And this part, and even and former type guide wire. Usually in this time we have to choose the polymer jacket guide wire. But as you know, this polymer jacket guide wire have the risk of the perforation, and sometimes automatically get advanced to the small branches and more distal part. And in this time, we would like to choose the steel coil wire. And but this Sion guide wire, you know, the Sion guide wire is a coil wire, and keeping the in the vessel and keeping the good handling, good maneuverability, like that. And amazingly, and excess the very big bend and still this guide wire, this Sion guide wire, keeping a good maneuverability, like that. And finally, we can get good result like this. Why the Sion wire have the good control? And because of the this guide wire have the composite core. And please look at this movie. And this one is a normal core guide wire. Normal core guide wire had a very simple structure. But on the other hand, this Sion guide wire have a little bit complex, and we call the composite core. And one of the cable tubes, and another one is additional coil and springs, and finally the whole and the outer coil. So we call this Asahi guide wire new technology is a composite core. I would like to explain more and using this picture. And please focus on the projection part of this Sion guide wire, this part. And from this projection part, including the not only the normal outer coil, and the inner side, this guide wire have the cable tube like that, cable tube. We called another say Act 1 system by the Asahi. Looks like a double coil, like that. And move to the focus on the distal part like this. And the distal part and included not only the core wire, and additionally the twist wire have the this distal part. It looks like a double core. And basically, as you know, the round core is have the good maneuverability, good transmission efficacy, but additionally, this twist wire have the good efficacy. And this is one of the key slides of this lecture, made of the composite core. And the portion part and this guide wire have their cable tube, another say Act 1. And this Act 1 cable tube benefits is one is a good torque transmission, and another one is a good durability. And move to the distal part. Distal part and have the round core and twist wire, and what is the benefits and for the having those two core systems. One is a good torque transmission and flexibility, and another one is a good durability. And so we would like to check the in vitro and in vitro experience. And I will show the prevention of wave motion. How about that? Left side is there. This is a guiding, and this young guide wire already inserted via this guiding, and the rotation by hand. And we can see the very smooth moving like that. We cannot see the wave motion, and after using a Sion guide wire. But on the other hand, in format type guide wire, we can see the wave motion. And looks like, in this time, looks like a very slowly, but suddenly, quickly moving this guide wire. We call this movement is a wave phenomenon. And I show that this graph. So this one is in vitro test and estimate the torque and the wave test. And this vertical line is the output angle, and the horizontal line is the input angle. And as you know, an ideal line is a 45-degree, one-to-one torque, like this black line. And please look at this yellow line. The yellow line is a format type guide wire. A format type guide wire looks like and potentially and the transmission power and the torque movement is transmitted to the distal part. But we look at this straight line. So in this time, and suddenly released this torque power, and there in this time, and easy to occur wave motion like that. But on the other hand, this Sion guide wire is this purple line. Is very close to the ideal line. So this in vitro test show that this Sion guide wire have the very nice transmission. And I show this Sion durability. So this bested in vitro model pushing this Sion guide wire, but after that keeping this shape. I show another one. So this one is a crash test, in vitro crash test, and for the estimated durability. And the left side is a format type 1, and the right side a Sion guide wire. And pushing this guide wire like that, and in a diameter 2.65. And after that, and remove this guide wire and already crushed this guide wire after that pushing this guide wire in the Homa type. But on the other hand, Sion type is keeping the pre-shape like that. And as you know, and the Sion family is 3 types guide wire. One is a Sion, and the second one is Sion blue, and the last one is a Sion black. And all Sion wire family and have their composite core. And due to composite core, Sion family have the good control and the good durability. And I will show the Sion structure. And yes, and as you know, Sion guide wire have the composite core, and it's another another point is full coating, full hydro coating like that, and the tip load is 0.7 gram force. And the Sion blue structure is a little bit different compared with the Sion one. And composite core have two, but this Sion blue and guide wire don't have full coating, and expect tip 15 millimeter. And from the tip, 15 millimeter don't have the hydrophilic cord. More safer wire compared with the Sion one. And their tip load is a 0.5 gram force, a little bit lightweight compared with the Sion one. And how about the differences between Sion and Sion blue? And lubricity analysis slipping is of the Sion blue is slightly less than Sion. And maybe they have the efficacy and for the safer. And the support performance of the Sion blue is slightly better than Sion. And because of this and the double coil part is a little bit extended to the tip cord. and due to core management. And last one is a Sion block structure. And yes, and a Sion block and have the composite core too. And the another specification is a polymer jacket. And this Sion block have the full polymer jacket. A very nice lubricity, very sleepy guide wire compared with the Sion blue and the Sion. And hydrophilic coating, full coating, and the tip load is a little bit heavier than the Sion and the Sion blue, 0.8 gram force. What is a Sion block? Please image this one, and composite core plus polymer jacket, A core, and Sion block. Lubricity of Sion block is better than Sion. This slide is one of the key slide for this lecture, and ASAHI SION family positioning. Please look at this figure. And this vertical line is a guide wire stiffness and lubricity, and the horizontal line is a more lightweight, is a more complex region. And Sion blue, so this blue area is a regular case. This pink color area is a complex case, and this purple area here is a CTO case. And Sion blue is supported the basically the regular case. Sion blue is a safeness, have the safeness and the supportability. And I would like to recommend for the normal case. And actually in my hospital, and Sion blue is used as the first and the guide wire for the normal case. And Sion is supported the regular case and between the complex case. Sion is a very balanced with safeness and crossability. And the please choice for the regular to complex case. And the last one is Sion block. Sion block is a good crossability. The first choice for the difficult case, like a torture part and classification and the strong bars and the beer stand strut. I would like to recommend. And I show the Sion blue case. This is RCA region. We can see the significant region in the distal part of this RCA. So in this time, even if the passes the guide wire, and additionally, and get advanced, there are another devices. In this time, very easy way to the automatic movement and move this guide wire. So in this time, so we worry about the guide wire perforation. And so in this time, so I choose a Sion blue guide wire for the safe. And including the main torture part, we need a support power. And that's why the second region and for the choosing the Sion blue guide wire for this case. And actually the passage the Sion blue guide wire, and so the after that, and a very easy way to the choose the good branches like that. And finally, we can get good result like this. And I will show the Sion block case. So usually we use the Sion block and for the classification and the tortures and the insertion the via stem strut. But so this is a very impressive case for me. So this case is RCA. And so actually this patient suffered from the AMI 5 days ago and coming to our hospital. And we can see the very big bend production part of this RCA. And there's I already information in the informed this case. And maybe the 5 days and after maybe this thrombus a little bit harder than the normal AMI case. I worry about. And firstly, I choose a Sion blue guide wire and Sion blue guide wire and for the safe. But very unfortunately, in this time, very difficult passage, this thrombus part, maybe this thrombus a little bit included hard matter and extended to the wire Sion block for the getting more lubricity. And after that, extend the guide wire from the Sion blue to the Sion block, and a very easy way to get advanced more distal part like this. Is maybe the Sion block, the lubricity have the good efficacy for the passage of this hard thrombus. And finally, we can get good result like this. And move to the more complex cases and for the using the decision families. And so this is their CTO data from the Japanese CTO PCI Expert Registry 2016. And I already published this data via Euro intervention and in this year. And I show the prevalence of guide wire types in the collateral channel guide wire crossing success group. And please focus on these septal collateral channel groups. And as you know, nowadays, mainly we choose the SO03 guide wire for the passage, the quarter channel. But still, this Sion guide wire have the good efficacy. Please look at this. And for the septal quarter channel, and SO03 is a 41%, and the Sion guide wire is still have the big range, 38%. And I showed the actual case. This is as a CTO, and I tried to the letter way PCI using this septal channel. This septal channel is connected to the RC distal part. This is a tip injection and using the Corsair. And we can see is a connection. But unfortunately, distal part of this septal channel is very uncertain. Looks like a thread-like connection. And from the J channel score, and maybe this channel have the score number is a 2. 2 is an intermediate. And from the Japanese CTO PCI Expert Registry, and if this channel is an intermediate, and from the Japanese CTO PCI Expert Registry, the success rate is 50%. 50% means this channel is an interventional collateral channel. And so in this time, I choose the Sion guide wire as a first guide wire for the negotiate this channel. And I would like to inform you and tips how to use this Sion guide wire for the tortuous and septal negotiation. And please make a bend and almost 19 degree. And they are very easy way to the passage, a very tiny and severe bend. They are like that. Base Sion guide wire is very have a good efficacy for the jails like the channel. So I suppose, and how about difference the compare with the SO03 guide wire? I think a little bit more good supportable and more good pushing power and have compared with the SO03 guide wire. And so another suggestion how to use a Sion family for the complex case. And I'll show the knuckle technique. Usually I choose a Sion block guide wire for the knuckle technique. This CTO is an instant CTO. And from the beginning in the stand, and the distal part in the stand like that. And so in this time, I use Corsair and Sion block. And Sion block is a brand pushing, and after that, automatically change the knuckle shape like this. And I get advanced to the CT region. And I check the guide wire position and angiography with that contrast looks like, and looks like be in vessel from this rotational angiogram. And finally, we can get good result like this. Take home message. Sion guide wire family have the composite core, and this composite core realize good handling and good durability. And Sion have the full hydrophilic coating and a good balance have. And the Sion blue have the partial hydrophilic coating, so they have the safeness. And I would like to recommend using a Sion blue for the fast guide wire for the regular case. And Sion black is a polymer jacket and have the good lubricity. And this is a last slide. And I would like to inform again, and as I Sion family positioning like that. Sion blue is for the normal case, and Sion is a regular Sion is have the well balanced with safeness and crossability. And the Sion black is a very nice crossability like that. Thank you for your attention.